Welcome, everyone, to our session entitled Beyond Treatment, Building a Framework for Your New Normal. And we indeed will talk about what your new normal means from a patient perspective in a moment. After treatment has ended, managing your new normal can in fact be overwhelming, and it can be difficult to know where to begin. In this session, our panel of patients and healthcare professionals will explore different approaches to managing your post-treatment concerns and embracing your new normal. With me today, we have Catherine White, who is a patient advocate and certified holistic cancer coach. We have Lisa Levy, who is a patient advocate coming from Montreal. And we have two wonderful physicians with us. Dr. Geneviève Chaput is a physician and head of the supportive and palliative care department of the Lachine Hospital in Montreal. And we have Dr. Stuart Peacock, who is a professor and Leslie Diamond Chair in Cancer Survivorship in the Faculty of Health Sciences at Simon Fraser University. Welcome to everyone today. We're going to get started, Catherine, with you, and if you could help people know a little bit more about you, your journey with cancer, and particularly focused on how you would define your new normal.
Yes, thank you. Thank you for having me today. I'm always happy to speak about my story. Again, my name is Catherine White, and I was diagnosed with stage 4 colon cancer in 2015. So I am 9 years out from my original diagnosis. In that time, I have had 6 surgeries. I've had 2 metastases in each of my lungs and a couple of little spots in my abdomen that had to be taken care of. But I call myself a cancer thriver because I have been able to navigate this post-cancer world. Truthfully, I spent all of 2016 wandering around my house, wondering what had just happened and how I was going to get my life back together. And from there, just decided that it was time for me to find a new way to live, to try to figure out how to manage the stress and the overwhelm, and really just embraced holistic modalities, body, mind, and spirit work to learn how to find calm in my life, to learn how to navigate going into appointments, to learn how to eat well, move my body, all of these pieces that I'm sure we'll touch on today that I think are really important parts of creating this life after cancer. I call it living with cancer because I know with stage 4, there's always that possibility as it's happened in the past. But I think it's important that we talk about, what we can do moving forward. And again, I appreciate being here today. Thanks, Anne-Marie.
Yeah, you're welcome. And I don't want it to be missed that you've actually become a certified holistic cancer coach. And maybe you can help people understand what that is. Congratulations to you, by the way, for taking what was a difficult life experience and turning it into something quite positive.
Thank you. Yes, I decided that I needed to do something with this gift of honestly the life that I've been given. I'm so blessed to be 9 years out from a stage 4 diagnosis. So I did take a certification as a holistic cancer coach, and I work specifically with women, although I have had a few men that honestly women to advocate more for getting that assistance. But I work privately in coaching, and I have a group program where we just talk about the realities. And a lot of the work that I do is mindset. People come thinking, teach me how to eat properly. Maybe that will fix everything. But a lot of it, I think, is really what I know is around creating self-belief and changing the mindset around having cancer and what that looks like, and teaching people that they can advocate for themselves, and honestly, like living in the moment, that we can't understand, none of us can understand what's going to come. And so when you have this diagnosis, I feel it's really important to live that joy in the moment, live life in the moment. So we do a lot of talking around mindset work, how to get in and out of appointments without, stress and overwhelm, and just really, I allow the space for the people to talk about what they need to talk about, because it's different for everybody. I always say you could line up 9 people with the same diagnosis, and it's going to be a different experience for everyone. So that space that I can hold for them allows them to have the opportunity to share things that they might be uncomfortable sharing with their caregiver or friends or family. So that's the essence of what I do now.
Thank you, Catherine. And to our audience, Catherine is located in St. Thomas, Ontario. And so in the chat, what we'll do, and as part of the notes, ensure that people who want to do connect with you in that capacity, Catherine, have the opportunity, and we'll put the information there.
Thank
Hello,
you.
Lisa. I'd like to now turn
Hi.
to you. I could see you smiling and nodding as Catherine was talking. If you could share where you're at in your journey, and particularly post-treatment, some of your thoughts.
Well, I particularly connected with what Catherine just said, in the sense that it's really different for everyone, and that not only is it different for everyone, but it changes along the way. So a brief story is I was diagnosed in March 2022. I literally woke up from my colonoscopy sedation and they told me immediately that I had cancer because they couldn't get the scope past the lesion that I had in my sigmoid colon. And 2 days later, found out that it had metastasized to my liver. So I'm stage 4 as well. And treatment has been ongoing since July of 2022, and I did have the mass surgically removed. Luckily for me, the only other place that there's been metastases found was in my liver, and they've been responding. I've had a very good partial response to treatment. And although it's been difficult and I have a really terrible skin rash from the targeted therapy, I've been managing for 2 years. And just when I was at my lowest point thinking, okay, prepare for the worst, this is not going to get better, I got a phone call recently saying that I was being evaluated for a possible liver transplant, which is very new in Quebec. And I'm just hoping that I can get that done. It would mean everything.
Right. Thank you for sharing a very difficult story. And so is there such a thing as quote unquote new normal for you? These words get used in these conversations, and your journey is ongoing, whereas Catherine, you're never really complete, you're living with, but you're still very much in the thick of it, Lisa. So how would you define normal, new normal in your world?
Organizing everything around treatments is the new normal, that I always have to plan that the time of my treatment, that I'll be out of commission for about a week after. And then I might have, depending on the frequency of my treatments, organize my life around that. So my treatments originally were every 2 weeks and then every 3 weeks, and now they're every 4 weeks. So I'm getting a little bit more good time. But basically, when friends invite me to something, I always have to put that little asterisk. And they understand. And it's okay.
Yeah. Thank you very much. Dr. Chaput, I want to bring you into the conversation, and certainly in the work that you do, you see a lot of different patients. And, just generally having heard Catherine and Lisa talk, what kind of guidance do you give people who are fundamentally post-treatment, and some of the key things that they can do to manage themselves?
Yeah. So thank you, and thank you very much for sharing. I'm always very humbled to hear patients, because we have to call you patients, but people who go through this and share their experience. And the message that I will say is that while I am a physician and my role is to provide guidance and accompany and give advice on the guidelines and how to do this, I will say that it's exactly what I just heard both of you say, that it's not a one size fits all. Of course, there are guidelines, there are things that we're supposed to do that are part of the science to do things correctly. But the most important thing is to have a personalized approach. And so I might be in front of a person who might say, I want absolutely no information. I don't want you to give me too much details. It makes me extremely anxious. I just tell me the minimum that I need to go to go on, so can I go to my vacation next week with my family? Yes or no, for example. And other people want to know everything and they want to delve into it. So I think what I'm saying is that it's exactly what we just heard both of you say, not one size fits all. And my job as a physician is to adjust to the person in front of me. I certainly wish that it was a one size fits all, because then I think I'd get like A+ from each patient every time, but it's not. And my job is to really understand the person in front of me so that I can best provide and that we can feel like we're working as a team. So really, it's a team effort. That's what I'd say. Yeah.
Thank you very much. And I love the personalized aspect of it. And Dr. Peacock, I want to now bring you into the conversation as well and get your general perspective on what both Catherine and Lisa have shared, the kind of patients that you would see, the kind of research work that you do, and what you're learning about how people can best manage themselves in a post-treatment situation.
Thank you. And again, thank you for sharing your stories. I'm always in awe of people who can and share their experiences when facing a very, very tough situation. I should say I'm not clinical. I don't see patients. I'm a researcher by background, and I work mainly in health services research. One thing I was going to add, I've been fortunate enough not to be touched personally by this disease. My mother-in-law is a 2 times colorectal cancer survivor. She's 92 years young. She had her first treatment in the 70s, and her last one was about 10 years ago. And she has taught me a lot about how things had advanced in that kind of period. And she said it was way tougher back in the 1970s, the first time she got this disease. So, and half of my family is at high risk of colorectal cancer as well. So this is something that's touched us personally. You know, I couldn't agree more with the remarks that Dr. Chaput has just made about personalized care. Each person is different. I've spent a lot of my career looking at quality of life. And in many respects, I'm more interested in that as a research topic than quite a few other things. And when I talk to patients, people who have experienced these diseases and other diseases, quality of life comes out as very, very important. And that's not necessarily something in the oncology community that we have got across that message. And each time I speak to people who've experienced this, I feel that. I also think a lot about how do we do this best? And we obviously have so many challenges in Canada at the moment, because this is some kind of a combination of primary care and also supportive care and long-term follow-up. And of course, we have a very acute problem with primary care access in Canada. And we have cancer systems that are becoming very, very busy indeed, and are only going to get busier as our population ages and grows. So we've got a lot of thinking to do about how to do this best. And I constantly remind myself I'm fortunate enough to live in a big city where I have access to all sorts of things. If you are outside of a big city, the experience for lots of people is very different for those who live in a big city and can access some of these tertiary services quite easily. So lots of issues to think about, and lots of work needing to be done about how do we best work with people as they live with cancer or beyond.
Thank you very much for that wonderful overview. And I do want to, you've highlighted a number of, I think, very important subjects that we want to get into. And let's get into the conversation around quality of life. And Catherine, I'm going to come back to you. And, you know, this definition of what quality of life is, Lisa, to you, is oftentimes different from a person or patient perspective than it is from a let's call it from a medical perspective. So maybe you could just talk about some of the quality of life issues that you hear in your coaching practice and for yourself that are important to people and patients.
Yeah, what a great topic. Quality of life is really subjective. So things that I hear are people talking about anxiety of even being around other people, the conversation of, oh, you look so good, but they're not feeling good. And even years out, you know, feeling tired and feeling like we've had previous conversations around brain and memory loss and these kinds of things that really have a long-term impact on people, like not remembering vocabulary or getting overwhelmed in conversations and feeling like they can't be part of a conversation because they feel like their brain isn't keeping up. And even things like, you know, what do I eat? There's a lot of time. I still myself spend a lot of time on what am I eating? What am I putting in my body? What am I putting on my body? Because that all gets absorbed in. Can I afford organic food? Not everybody can. Access to quality food, not everybody has that. And so these are things that I think carry into that post-treatment phase of life. Like, how do I stay the healthiest that I can be when things aren't always available to me, and you referenced small communities, like that stuff's not always available in a small community either. And then the impact on the physical body as well. And we do a lot of talking around scars, physical and emotional scars, but even, the changes in bodies when people have had surgeries or ostomy bags that are life-changing, permanent ostomy bags. Like, what can I wear? Can I go out? I'm afraid to leave my house. These are real things that impact the women that I'm speaking to. And I know, again, for myself, I'm blessed to be this far out, so I've been able to work through these things, but it really takes time to wrap your brain around what just happened and how do I keep moving forward and find this new version of myself and try to feel like a normal person again. But I'm not convinced that we actually feel like a normal person. Again, we have to, like you said, create that new normal for ourselves. Who am I now and what do I want for myself? So for me, it's embracing joy every day, like just finding it. Doesn't mean that life's all rosy and sunshine. There's hard days still, but just trying to find the joy and trying to embrace the gratitude and move beyond those physical limitations and find ways to work around them.
Yeah, thank you. And Lisa, I wanted to get your point of view on this, but before I do, I'm going to go to Dr. Chaput. Dr. Peacock, there's kind of two streams, if I'm simplistic about it. There's the physical care that's required post-treatment, but there's the emotional care. I'll put those in two key streams. Like, how do you advise post-treatment people to like what is the stream on physical care? What is the stream on emotional care? And how do you, it's very complicated. And as you say, it's individually focused as well. So how does someone even think and begin with the guidance from people like you?
I can start. I can say that quality of life, I agree, it's subjective, and it's also what I define as quality of life will not be the same thing as what Catherine or what, Lisa might, or, so that's number one. All of this makes me think of the key element to success in the post-treatment, in the diagnosis, in the treatment, and in the post-treatment, throughout the trajectory of cancer care, and it's communication. And for me, it boils down to communication. And I understand that, there are physical symptoms in the post-treatment phase. There can be some pain, there can be some adjustments, some unfortunately some symptoms due to some treatments, like diarrhea and having issues. Yes, of course. And then there's also some psychological, emotional symptoms. But at the end of the day, we have to see them all encompassing together. A whole person is a whole person. And I sometimes am as blunt as saying, you're not a colon, you're a person, and your symptoms will be, if I'm feeling like crap because I have pain, it's probably going to affect my mood. So the number one thing I would say would be communication. How do I know what's quality of life for Catherine? How do I know what's quality of life for Lisa, for example? And it boils down to opening that communication, creating safety and being permissive. And sometimes in the office, it's things like, hey, sometimes people tell me that they have issues with intimacy because now, kind of got a bag and an ostomy. And is this something that's been on your mind or not at all on your radar? And do you want to talk about it? Offering permission and offering, little key words to try to get the person to maybe open up or not, and giving permission to the person to say, hey, that's not on my agenda. So communication as to what I'm supposed to do as a doctor, and I'll just close on this, but also what the person in front of me needs. So sometimes I make jokes, because of course, time, we have so little time, but you have to make time. I say, this is my agenda today as a doctor, because I've got these things I'm actually supposed to check to give you good care. What are the things you wanted to talk about today that are important? I guarantee you when we do it this way, we meet the quality of life agenda so many more times. We have to meet in the middle. So that's what I'll say. Communication is key.
Dr. Peacock, I mean, you're in a research environment, and what kind of work is actually being done to substantiate, to build on improving quality of life in the post-treatment phase of a cancer person with cancer?
Yeah, well, the first thing that springs to mind is we now have a lot of evidence that developing a survivorship care plan while you're in active treatment with your oncology team, which then is passed on to your family practitioner if you have one, that maps out the things that you need to consider and gives you information and the types of follow-up care that you might get. The big challenge there, of course, is the millions of people in Canada who don't have good access to a family practitioner. Back to the one size fits all, one thing I would say is there's tremendous variation in Canada about whether an oncologist is going to follow you in the long term, whether it's going to be a family practitioner, but that's normal. That's true of any health system. You get that variation. What we do know is this survivorship care plan is terribly, terribly important, that we have some plan in place. And I believe every patient should do that transition back to, quote, the new normal life with some kind of plan in place. I personally, I know I would prefer to work with my family practitioner on these things in the long term. But, you know, it depends on availability. The consultations that we tend to have are a little bit shorter than they used to be, say, 30 or 40 years ago in some cases, because we're just pressurized. Definitely true in oncology in the cancer setting that the appointments are much more pressurized. I encourage people to speak to all of their oncology team. I find nurses are incredible when it comes to quality of life, and they may be a source of great wisdom. We have lots of good evidence around needing to improve quality of life and some kind of interventions for people living with cancer in the long term or surviving. And the issue of the ostomy is one of the biggest ones, that we know that people who have the ostomy have poorer quality of life, poorer mental health, lots of anxiety and depression. So finding people who can support you if you're going through that, we know there's lots of evidence to say we should be doing that, but more generally, we need to be providing that psychosocial support for all of our people experiencing cancer.
Yeah, thank you. Lisa, I want to bring you into the conversation as well. So we've talked about a lot of what I call the options: survivorship, care plans, resources for people with ostomy. There's all kinds of, there's just layers and layers and layers on what I call things that require resources. I'd be curious to understand how you've defined your quality of life. Have you been able to access resources to help you, and how that might help others who are struggling a little bit with where to go, who to ask for certain things? Did you even have a survivorship care plan as part of your treatments?
If I did, it wasn't called that, but as Dr. Peacock was saying, I am one of the lucky ones who's in a major city, and I do have a family doctor, and I am at a major cancer center in Montreal. So when I had any kind of problem, I had a pivot nurse who could connect me with the right team to take care of it. For example, my skin issues got sent to dermatology. My mental health issues, I was referred to the psychology, and there's a special oncology psychology department where I received a nice consult. And any other things that I had issues with, I could always call my team to help. My coordinating nurse, my pivot nurse, and all of these things were wonderful to have. When I needed help filling out forms for the government, I could have accessed social workers to help me with that. So I was in the best of, and am continue to be in the best of care with my nursing team. Also, Dr. Peacock mentioned how important they are, because they're the ones that you sit in the chair with for 7 to 8 hours, and they help you along. As far as survivorship and what ongoing treatment will look like, in my case, I kind of took it in hand myself and did things at the outset when I still had a lot of energy. I did things like clean out my apartment. I made a succession plan for my birds, because I do keep parrots and they live a long time. And I was worried that I was going to expire before my yogurt did. And I had to make plans for their future. things change though, and I'm very happy to announce that things are looking a lot more optimistic for me right now.
Yeah, thank you so much. It's this issue of resources that I think we've touched on a couple of times. It's wonderful that you're in a center like Vancouver where you have resources, or like Montreal where you have resources. Dr. Peacock, you did talk about the issue of access, particularly if you're in a smaller community. Catherine, you're located in St. Thomas, Ontario, which I know is not a major center here in Ontario. Like, how to people who are listening and who are going, yes, I'm interested in a survivorship plan. Yes, I'm interested in talking about how I can get some help with forms, et cetera, et cetera. Where do they even begin? Catherine, maybe I'll ask you to begin with that question.
Oh, that's a great question. I'm fortunate to be near London, so I had access. My oncologist is actually at London Health Services. But interestingly, when I did my treatments, what LHSC has set up is satellite bases that offer chemotherapy. So I was fortunate that I was able to go to my St. Thomas Elgin General Hospital, where there was only 8 beds, and have very personalized attention when I was having my treatment done. I will say I don't feel like I had access to other resources in terms of filling out forms and things like that. So I think that that's where, you know, a platform like this in Colorectal Cancer Canada is huge, that people can come and do the research on one site, because getting down that rabbit hole on Google can be very overwhelming, as we've talked about. Like, it's easy to get into overwhelm. So I think that when things are all in one place, for people like myself who don't want to go on Google, it just makes it easier to know you can go to one center. I'm not sure that I'm really answering your question, but I think that there's just so much overwhelm of when you don't know what to do, that you know, that binder that you get when you've been given your diagnosis. I almost feel like it needs to be a little bit more user friendly, because it's very overwhelming, and the resources must be like right at the front. Here are like your 3 choices of where you can go if you need assistance, because there's just so much to try to sort through when you're, again, I come back to that, like, what the heck just happened?
Yeah, it is overwhelming. Dr. Shapiro, I can see you're nodding, especially on the binder with too much information that is difficult to
Yes,
understand. Like,
I
how do
try.
people actually get to, I think many people understand what they're supposed to do, they could do, but it's getting to those resources, understanding those resources, having somebody help them with them.
Yeah, I agree. In general, I do agree that, you know, there are variations across Canada of resources and who can access what. And I mean, obviously, we have to work on this whole equity and equality. But as a general rule, thankfully, there are some resources. Just, you know, wherever you are, there are some resources, even though they're not organized all like the same, depending on where you are. So it really boils down to communication again about, you know, I'm hearing Lisa, well, I had some mental health issues. So it's just having that right provider that you trust. And for Lisa, she's like, you know, for me, it's my nurse. I was with her for 8 hours a day, and just having the opportunity to say, hey, like, I'm kind of feeling this, and that person may be able to guide. So it's really back to opening that communication. And why I laughed at the binder is, you know, I also wear because we have to tag things. I wear a caregiver hat with my husband, who also is a thriver of cancer. And I remember specifically receiving that large binder that is so well intended. My husband received it and he said, this is way too much information. I'm completely overwhelmed. And my husband said, because we communicate, he says, look, you read the binder, you know me, and give me the down low on like a 2-minute summary. And if there's anything, please refer back to the binder. It goes back to communication of like, what are my informational needs as a person while I'm going through cancer? And some people, they have lots of informational needs, and some people have less. So it really is about just finding that one provider that you trust, opening that communication. And sometimes it's your family doc, sometimes it's your oncologist, sometimes it's your PIVO nurse. Finding that one person and saying, hey, this is my need. And then hopefully someone be able to facilitate. Yeah.
Yeah, thank you so much. Dr. Peacock, you opened the door on this conversation of access and equity, and I would be remiss if we didn't bring it back to you a little bit, is, you know, for people who particularly are not in major centers, what would you advise them to do in terms of finding the help they need, either physically, emotionally, or otherwise?
Yeah, I think we've had some excellent comments there. I couldn't agree more. Finding the right person to help you in communication, and Catherine's raised a good point as well there. In lots of provinces, a lot of chemotherapy, for example, is provided in community hospitals, and they can be quite small hospitals. It's not necessarily a cancer centre in a major urban area that's providing chemotherapy. One of the interesting things that came out of COVID was the development, and we're on Zoom today, of virtual care. And sometimes we're playing with the term a little bit, because virtual care in a lot of instances is a phone call rather than a Zoom, but it can definitely be face-to-face on a Zoom. I work with a non-profit organisation called Inspire Health that provides supportive care, and it kind of plugs some of the gaps that we miss. And I know that in BC, we're expanding supportive care as part of BC Cancer as well. What we found is virtual care can be quite a useful tool. It is not a substitute for in-person interaction. And it suits some people, but it doesn't suit other people. So it's again, it's not a one-size-fits-all. And we now have some good evidence that if a person's established a relationship with a care provider face-to-face, moving to Zoom or something like that, they feel quite comfortable with. They're much less comfortable if they've never met that clinician before and it's the first consultation. And obviously some people are more comfortable with technology than others. But that has opened up a little bit of a window for us in addressing this health equity issue about rural, remote areas. It just gives us another tool we can use to connect people. But like I say, not a substitute, but I actually feel quite good about this. Canada, obviously, there are a few countries like this in the world. I worked in Australia, the same problem. Wide open spaces and super long distances to physically get to people. So coming up with novel ways using technology to try and bridge that gap, I think, is one very valuable way forward.
Thank you. I want to give you an opportunity. If we got this right, Inspire Care is the organization that...
Inspire Health.
Okay. Yeah, can you give us the web link to that? And we'll put it in the chat as well. Do you want to just, how can people get in touch with that?
And I should say there are a number of non-profit organisations working across Canada. They differ by province, connecting through organisations like Colorectal Cancer Canada. They often have the links, and there are a wide range of organisations out there providing these types of supportive care.
Thank you very much. Yes, and Colorectal Cancer Canada is well connected across the country. So no matter where you are, if you have a question, I know they would welcome it. I want to bridge into a really important conversation that I know is on a lot of our audience's mind, and that's the return to work after you've gone through a really difficult life experience with cancer. And so, Lisa, maybe I'll go to you first, and some of the considerations you had, some of the decisions you've made, some even the feelings that you experienced as you assessed what next from a work perspective.
In my case, I initially thought I'd be off work for 6 months and then back to work. And then I found out how serious and how advanced my cancer was. And 6 months turned into indefinite. And then approximately a year and a half into my treatment, my doctor just shook his head and said, "You're not going back to work, darling. You're not going back. Here are the paper. Give me the papers. I'll sign them." And that was a shock to the system. Because as Catherine mentioned, I have suffered some cognitive deficiencies where I can't recall things, and in going back to work, that created anxiety about going back to work. But at the same time, I expected to go back to work. And then when my doctor shook his head and said that's not going to happen, I had to adjust. So by taking on austerity measures in my own home, changing the way I did groceries, changing the way I spent money, I adapted because it's about quality of life again. But in my case, unfortunately, it doesn't look like, unless things really radically changed that will be going back to work,
Mhm,
which is
mhm.
relieves stress in a way.
For sure. And maybe you could just comment briefly then on what I call the financial issues that you're dealing with, having been put in a situation where that decision was made for you.
Yeah, I mean, my long-term, at first I had to go on Canadian employment insurance, which, doesn't pay a lot. That was my first 17 weeks. And then I had long-term disability, which was approximately 55% of my gross salary. And on that, you still have to pay taxes. So yeah, it was a huge whopper of an adjustment for myself to
Mhm,
make. Living
mhm,
on my own, I'm also single. I do not have
mhm.
another person in the household to support to my income. I do have a wonderful family, and I did move in with my sister for 5 months, which really helped. But now I'm back here, and obviously things like luxury expenses that I was very much into travel, and that's off the agenda right now.
Yeah,
So
yeah.
those
Maybe
are
you
the
could,
changes.
Lisa, with all you've gone through, is what might you say to somebody who's at the earlier stages of a situation such as you found yourself in?
I would tell them you can do it. It feels like a real hardship at first.
Mhm,
Just change a few things. You're not spending money on going to the movies as much, and you're not spending money on travel, and you're not doing all these things, but your situation could change.
mhm,
So think about how you're spending your money. Do you really need those luxuries? You don't need that new purse. you
mhm.
you can do it.
Yeah, thank you so much. Catherine, your cancer gave you a career change.
Yes.
Can you,
Yeah.
and then rather aspired one, I might add.
Yeah, I was a public school teacher when I was teaching grade 8 when I was diagnosed. I actually was on leave. I was supposed to be traveling on leave for 6 months, and then I was diagnosed, and that changed my entire sabbatical. And I recall, I was diagnosed in January of 2015, and I remember in like February looking at my husband and saying, I cannot go back. I already know that I cannot go back to the classroom. Um, and by the end of 2015, when all of the surgeries and everything were done, I knew that that was the best decision. I knew, Lisa mentioned that cognitive like disconnect is just, I knew that I wasn't going to be able to stand in front of a group of teenagers and navigate that. And interestingly, the school board wanted me to return to work 3 months after I was chemotherapy. And I remember going in and talking to my doctor and saying like that, I can't barely remember my name on a good day. How can I go back to navigating a classroom? So I was fortunate that I was able to leave my job. I have a husband who has a career that was able to support our family at the time. But it's that piece that I find so interesting, that I was literally given 3 months to figure myself out and then go back. And it was like, well, you could come back part-time. Well, then you could just increase your time, but it doesn't take 3 months to get chemotherapy out of your system and recover from colon surgery and liver surgery and the trauma. So, I think we need to look at extending timelines for people because of all of the things that we've been talking about. So I did take, my teacher education and become a teacher in a different way. I didn't think that I'd ever have a career because I thought, well, I'm just a teacher. I don't know what else I can do. But now I teach privately in a different way, and I feel again very blessed to be able to do that. But I know, like, again, it's different for everyone. And to ask people to go to work when things are still not emotionally and physically and mentally sorted out, I think we need a better system than, well, you're okay now, you're all done, you rang the bell, time to go back.
Mm, mm.
I
And
agree with that.
I was going to say, Dr. Chapu, what has been your experience? I'm sure you see this daily.
Yeah, thank you so much for sharing. The return to work is a part that I'm very sensitive to. And, there's acknowledging the experience of the person, there's acknowledging, there's validating what the person is going through, and then there's like, what's the plan for that? And there's a wonderful resource that I was lucky to participate in terms of review. It's called Cancer and Work. It's an initiative across Canada.
Yes.
It's a resource for quote unquote patients, but people who have gone through this. It's also a resource for professionals, and it's really meant to be a resource that empowers people and raises awareness and educates. And I agree on that one. Colorectal Cancer Canada and like every other policymaker, we have to work on advocating. In other areas like in Europe, the leave during a health crisis as difficult as cancer is much longer than what we have in Canada. So that I call upon policymakers for that. So, and in the meantime, resources like Cancer and Work, and really redefining what is capable. For me, it's about capacity. Sometimes I normalize things. I say, do you know that you're a full-time patient? Even though I despise that word, the pressure that are expected upon people who are going through these difficult experiences is, we really have to sit back and take a moment and say, okay, this is not like surgery's done. It's again seeing the person. Surgery's done, cancer's out. The person is not a cancer and a tumor. The person is a person. You completely forgot that they're also maybe a wife, a mother, a this, a that, who knows? So I call upon policymaking to continue increasing those financial burdens that people with cancer have to go through. Shout out to you for your wonderful, like the way that you've described that, Lisa, and just adjusting. I'm gonna be a bit more of an advocate here and say we need to do better, and people should not be living in financial scarcity because they have been what I call a victim of a horrible diagnosis. So we got to do better on policy making for that.
Yeah, and Dr. Peacock, thank you so much for sharing the link. We'll make sure that our audience 100% has that. Can I ask for your comments? It sounds like you've had experience with this organization.
Yeah, and Dr. Chaput's made the 2 points I was going to make, so that's fantastic. Yes, the Cancer and Work website has been around now for probably 10 years. It's run by researchers in Quebec and in BC, Christine Mayhew and Maureen Parkinson. It's a fantastic resource. They are currently developing clinical trials, randomized controlled trials, looking at different interventions to help people back into the workplace.
Oh, that's very interesting.
They are very active in doing research about this. It's a challenging area to work in because our health research councils and funders don't really think about return to work very much for people experiencing cancers. But we're trying to raise the profile of this as an issue. The other point that I was going to make as well, and Dr. Chaput's nailed it, the EU seems to be the world leader in being progressive in helping people who've experienced cancer back in the workplace. And they've identified cancer survivors as being a key element of the economy and needing, from an economic lens, needing to help people back to work if they want to, who are cancer survivors, because they are such a large proportion of the population now. What I would leave with is encouraging organizations like Colorectal Cancer Canada and patient advocacy groups to lobby with the health minister and also lobby with the finance minister on this topic. And I would suggest a good starting point is to look at the EU framework, because they really are leading the pack on this, I think.
Thank you so much. And this has been, I think, that a very important topic as part of this session has been raised, noted. And I 100% know that Colorectal Canada is very interested in building on initiatives such as you've mentioned. We only have a couple of moments left, and I wanted to close on the best guidance possible, particularly from an emotional perspective, that each of you would provide to people who are sitting in our audience today, who've gone through their treatment, they've been diagnosed, they've gone through their treatment, they're at a stage now where they're what next? And I have to believe that, and certainly it's been reinforced in this conversation, that your emotional state, your emotional well-being is the most important thing that you can possibly do. So I'm going to just go around the table as we close this session before our Q&A. Dr. Chaput, what would you tell people to do first?
Oh, well, I'll just say my job will be to screen and make sure that there isn't, unfortunately, an underlying mental health disorder that has, like developed, like anxiety or depression. So my job in advocating for the person so that they're not the only ones having to take care of their mental health, because it's such a burden when you do put it this way, right? My job is to make sure and screen and assess, to make sure that, that's something that we have to take care of if we diagnose it. And I find myself as a physician, I'm supposed to be making prescriptions of medications, but I have a lot of different prescriptions. And I often find myself writing things like, be kind to yourself, respect your limits. Capacity is a real thing. When you feel full, that means you're full. And sometimes I'll actually write prescriptions like that and give it to people. And it seems to be quite effective. Giving yourself permission to be where you're at now, understanding that you want to go there in your recovery, but be patient and kind to yourself, because the amount of time you took to go through treatments and surgeries, you probably need to give yourself as much time, if not more, for the recovery. So I try to frame it this way. Just be kind to yourself.
Yeah, beautifully stated. Dr. Peacock?
I think it all comes back to talking and trying to connect with the right person for you to take that first step forward. So that may be part of your oncology team, that may be a family practitioner, that may be a peer support worker or someone that you connect with through an organization, a nonprofit, who understands what it is to live through the things that you're living through. So I think just taking that first step and finding the right person for you to connect with, that's often one of the biggest hurdles. And then you get into the stuff that Dr. Chaput's just talked about there as well.
Yeah, thank you very much. Lisa?
I agree. Giving yourself permission to rest and recuperate and not feel obligated to do all the things that you might have been when you were at 100% health. Book that into your schedule, knowing that there will be that week of relaxation after treatment. Know that and just accept it. And it's okay if you don't make your bed that day. It's okay if your house looks a little messy. Just give yourself permission and don't beat yourself up for it. You've been through a lot.
Yeah, thank you, Lisa. And Catherine, you get the final word on this, because I know that this is a subject you're magnificently passionate about.
Thank you. I would be remiss to not recommend holistic practices outside of the medical world. That I advocate strongly for yoga, gentle yoga practices, mindfulness, meditation, breath practices, even just learning how to connect with your breath for all of the reasons everyone's already mentioned, of the overwhelm and the stress, and just exploring what else is available. And they don't have to be things that cost a lot of money. You can literally put your hand on your chest and take a big breath in and just feel connected to yourself. I think we really need to lean into believing in ourselves, that we actually have a lot of resources inside of ourselves. We just need to remember that they're there, or learn how to access them. And asking for help. I believe that asking for help is one of the hardest things, but it is our superpower. Asking for help is a superpower. And when you can harness that, there's so much that is available. And we just need to remember that.
That's a beautiful way to end this session. I want to thank Dr. Chaput, Dr. Peacock, Lisa, and Catherine. All of them have agreed to stay to answer any questions that you may have. Do ask for help. As Catherine has said, we're here. Colorectal Cancer Canada is here for you as well. And we'll open the floor now to questions. Hello, we're back again for Q&A, and we're very happy to welcome Dr. Peacock, Dr. Chaput, Lisa, and Catherine, who've graciously agreed to answer any questions that the audience might have. We've got several coming in, and I'm going to get to them right now. Iris, you will put those up for me. There we go. Okay. The first question that we have here is, I'm worried about how to manage fatigue and any lingering side effects of treatment while at work. What are the strategies for dealing with this? So this is a question I think that can be answered really by several of you. Maybe what we'll do is we'll start with Catherine and Lisa and take it from there. And if there is from our two wonderful oncologists other techniques, then we'll bridge into that. So Catherine, if you don't mind.
Yeah, so fatigue symptoms at work. I would say that hydration is really important, like just making sure that you're drinking water. As much as it might seem counterintuitive, getting up and going for a little walk if you're able to, if you're at a desk job, if you're at an on your feet all day job, finding the opportunity perhaps to sit down for a few moments. Rest is important, but movement in managing fatigue is also very important.
Yeah. Lisa, anything you'd like to add to that?
Wear a lot of sunscreen. Your skin becomes really sensitive to the sun. And wear a hat when you go out. And if you do have side effects caused by your treatment, like skin rashes, as I do, just again, hydrate is very, very important. Hydration is very important for your skin. And Vaseline is the cheapest, easiest moisturizer that you could use. And that really mitigates any skin issues that you might have.
Yeah, thank you for that. Dr. Peacock, Dr. Chaput, any comments on it's the comment of, managing your cancer while you're in a work environment. That's quite different than when you're in your own personal home or environment. Any kind of tips that either of you might want to offer?
Yeah, I can pitch in. So, in addition to what Catherine and Lisa has said, I think for me as a physician, it also boils down to making sure that the work plan that is currently ongoing while you're going through treatments is actually one that is realistic given the circumstances. I think that goes a very, very long way. I'm not going to run a marathon tomorrow because I would get short of breath in a minute. Like I haven't trained. And it's the same thing. I think it's about making sure you have a team that is supporting you. And so that what is realistic in terms of work, what is realistic in terms of finances for you too, needing to work and making sure that those expectations are realistic so that you can perform as best as you can under the circumstances in your work. You can't be the person leading the 16-hour a day project. If anybody does that, you may want to change jobs. I'm making a joke, but be kind to yourself. Have a team that's behind you, supporting you to make sure that it's actually realistic as you're going through treatments, because you don't have the same level of energy. So that's what I'd say.
Yeah, thank you. Any final comments on that question, Dr. Peacock?
Yeah, just one. There have been some great points there. There's a lot of evidence now that physical exercise programs can help manage lots of symptoms to do with survivorship. And it seems counterintuitive, but when I say physical exercise, some of the programs are very modest in terms of, might be an elderly person getting up and sitting down again 30 times or something like that. So you can explore whether there are physical therapy programs that you could potentially work with just to build up a little bit of fitness. But I say that very carefully because I agree with all the previous points. You don't want to overdo it. You want to have a manageable, realistic plan.
Yeah. Perfect. Thank you. Dr. Chaput, I'm going to kind of start the next question with you. And we've used the word survivorship a few times throughout our session today. And the question here is, what's actually in a survivorship care plan? Is that something that is standard care, or is this something that somebody who's going through and has completed the treatments needs to ask for? What's the process around all of that, and what does it actually include?
Mm-hmm. Well, I think I would say that it depends who you ask. If you ask the person who's going through the cancer, if you ask the physicians, if you ask people who make rules and governance, about healthcare, it depends. But the short of the answer is, the survivorship care plan, it's meant to be a document that has all the information about your care in the immediate, but also in the after. You know, what are we supposed to do for you to stay as healthy as possible, and also monitor for things, yes, like cancer recurrence, but also the potential side effects that can occur due to your treatments that you've had, such as fatigue, which we've just talked about. With that being said, unfortunately, we are in a time in Canada where it's not standardized to have the survivorship care plans instituted at every site. And so sometimes I find that people who go through cancer are left to themselves to like kind of grab the information from all different resources. But most certainly, whether your center is actually one that promotes the use of survivorship care plans, these are available online. And I encourage anyone to go and get it, because it actually contains the information that can help you advocate for your best health. So if your center is not doing it, there's other ways of getting it, and then you can be an advocate and bring it to your team and say, hey. So that's what I'm saying.
Thank you. Catherine or Lisa, did you, either of you actually receive a formal care plan, or is this something you had to advocate for? What was your, what were your experiences?
I can go ahead and say that I came with a very specific type of cancer, which had a gold standard plan, which was very simple to explain. And the side effects were explained to me just verbally. I didn't receive any kind of binder or packet. No, I didn't receive anything like a survivorship plan.
Yeah.
Right. And so you had to embark on your own journey to find that.
Yes.
Yeah, I don't recall receiving one either. Sort of the verbal, like, okay, in 3 months we'll send you for a scan, and in 6 months if that one's clear, and you know, sort of that the long-term goals of maintaining no evidence of disease, but never anything that I can recall formalized on paper. It really became for me like, okay, now what am I going to do? And talking with other people who had a stage 4 diagnosis, you know, they started to make suggestions, which led to me taking nutrition training and yoga teacher training and becoming a coach, because that was all that I could, that was what I could do for myself. But no, I don't recall a plan.
Yeah, well, thank you for saying it that way, Catherine. So, you know, especially because you are a coach, what guidance would you give to people where no plan is presented, or where the conversations like this are elevating the awareness level of what's possible? What would you guide people to do?
Self-advocacy, like truly like ask the questions, and it's not about don't accept the no, it's about advocate for a yes. Like, okay, so now what is next? What can I do? Why do I have to find this on my own? I'm already overwhelmed. How do I find this? Like it's important, I think, in that survivorship model for people to be able to have resources, know where to go for resources, but also to have their voice. And oftentimes I find the voice is lost because it's just so overwhelming. And so I try to encourage people to find a way to have that conversation and to persist if the answer is, well, you can find it on the internet or Google a local massage therapist or something like that. I think there has to be better than that.
Yeah, thank you very much for highlighting what is clearly a gap. And again, I want to reinforce that organizations like Colorectal Cancer Canada are really a wonderful go-to authoritative resource for questions and concerns in this area. I'm going to, Dr. Peacock, bring you into a question here, which is asking, is there research that supports obtaining or addressing emotions linked to the fear of reoccurrence of your cancer?
Yeah, there's a lot of research here, and you know, we know that about 75% of cancer survivors experience ongoing anxiety, probably for the rest of their lives, to different levels. And you know, we're human beings; we all experience anxiety in different ways. But some of these feelings of anxiousness may be quite profound and clinically need some care. So yes, there's a lot of research there with fear of recurrence. This is something clearly that plays on people's minds. And we're doing our best to tailor some of our survivorship care so that we can identify people who have really high levels of emotional distress associated with the journey that they've been on, so that we can provide support and counselling as we go forward. But this is a theme I think I've touched on already, is we're only just beginning to understand addressing the mental health needs of our cancer survivors, and there's so much more work we need to do in that area.
Thank you for
If I
that.
could, that's amazing. If I could add something to what Dr. Peacock was saying, I fully agree about the fear of recurrence being well studied, and we have to continue in the clinical world to do our job as well, right? So there is a part in terms of the gold standard of care where addressing it might mean normalizing it. I think it is okay that there is going to be a fear of recurrence, and validating that experience for the person, as opposed to perhaps the idea of like, well, don't worry about it. I've already told you that you're okay. Like your repeat imaging was fine. Like, not denying the person's experience. It's a very real experience. It's a lifelong experience for the person who's been through the cancer. So validating, normalizing, these are part of the gold standards of care. And the other thing that's part of the gold standard of care is just like Dr. Peacock said, it's one thing to find fear of recurrence and distress, but it is our duty to also screen to make sure that this doesn't maybe transition and develop into an anxiety disorder or depression, because we know that cancer survivors are at high risk, more than the general population. And anxiety and depression is not treated with just like, hey, you'll get better. We need some emotional support. We need some measures, both pharmacological and non-pharmacological. So it's a team effort between the person who's gone through it and also us as professionals.
Can I jump in there? Sorry.
No, please, Catherine, go.
I think it's important to almost have just like a list of like the things that people feel like, that we in the cancer survivor world talk about scanxiety. Like, even that idea of walking into a hospital is overwhelming. The smells, the sounds, the pain in your side, that it becomes that overwhelming fear of, is that the cancer? Is it back? And so, it's easy to be a number in the system, to feel like you're a number in the system. And so the education for our healthcare providers around the compassion of, no, it's just an ache, or no, you don't need to worry about that, I think is a really important part, because, a swollen lymph node can send like a catastrophic emotional chain reaction through a person, even though it might not be cancer, but it is that fear, that chronic fear of what if.
Yeah. Thank you for communicating that. It's actually a wonderful bridge to a question which I'll let you decide who would like to take it, but it's the idea that how can I communicate with my family and friends that I'm still having some physical and emotional symptoms or side effects that may impact my ability to participate in the activities that they want me to participate in. So the thought being, well, you're finished your treatments, you should be okay now. But it's this post-treatment emotional and physical experience that people are having. How do they have the conversation with family and friends who are expecting them to be well and move on with their lives? Dr. Peacock, maybe we'll start with you, and then
I think that's such a challenging question to answer, and such a good question. Obviously, a lot of it is highly personal, and it depends on you as an individual and how you relate to your different family members and the different significant people in your life. It can be very challenging if you don't feel like you want to open up about your cancer treatment trajectory. It can be challenging to talk about that. This might leave you with lifelong challenges that you then have to face. I'm generally in favor of being fairly open and trying to have an eyeball to eyeball conversation with a relative to say, look, this is my reality now. I'm tired a lot of the time. I have some anxiety, and the treatment I got leaves me with this type of problem. So just please be understanding and caring about how you interact with me. And if I decide that I don't want to interact in a given activity, please don't worry about it. There's nothing personal about this at all. beyond that, it will vary so much between the type of relationship you have with individuals and your degree of comfort you feel in sharing some of these things.
If I could just join in on that, what Dr. Peacock is saying makes me, the question is such a relevant one. It's one that we get all the time in the medical world. We have a cancer trajectory. It starts with screening, and then diagnosis, and then treatment, and then a survivorship phase. And it's in a little line, and it's quite linear, and there's these categories, and then somehow doctors were supposed to know how to follow them, but it really isn't like that for the person who goes through it. And we know that when the treatments are over, it is recognized as a very difficult time, and it's overwhelming, and lots of different emotions and side effects can occur. So I think in keeping with Dr. Peacock said, I think it's an exercise of boundaries, and I also think it's an exercise of capacity. So boundaries in the sense that, one size does not fit all. Some people might be comfortable to share specifically, and that's what they should do. And some people might not be, and it's important to respect your boundary and capacity as well. I'll make a joke, but for my husband, his capacity is I am not answering anything to anyone, and I relay all information to my wife, and she's my emotional translator. And I'm making a joke, but that's okay. That if that's that way of coping versus someone else who might say, no, I'm going to take charge, like Dr. Peacock said, and I'm going to share, hey, don't take it personal, but for me, this is the way it is now, and it's changed. So respect your boundaries, try to understand what your capacity is, and try to honor it. And at the end of the day, it's not a one size fits all. And so sometimes we evolve in some friendships and relationships as a result, because people might not understand what we've been through. It's about feeling safe with the group that you are surrounded with.
Mm-hmm. Catherine or Lisa, as we close this Q&A, would you like to provide any final comments as a build on what Dr. Chaput and Dr. Peacock have communicated? Personal experiences?
Go ahead, Lisa.
I was just going to say that as a stage 4 person, hearing the stories of people who have lived for 9 years in your case, or 14 years in another case of a woman that I heard about yesterday, please stop hanging on to the stage 4 as a death sentence. It is not. Mm-hmm. Every day is important to keep moving forward and keep up with the science, and new things are happening all the time. And I think that's the biggest thing that the new normal should be, rather than dwelling on the gloom and doom.
Lisa, that was beautiful and so well said. Yes, stage 4 is not an end game. There are a lot of people who are living with stage 4 diagnosis. I think we should leave it at that. That's the perfect way to end. Thank you for sharing that.
Yeah, and I want to thank Dr. Peacock, Dr. Chaput, Catherine, and Lisa for again joining us and being so wonderfully open and transparent in your responses. And we're going to end the session now.